I want you to give me your full attention for the next few minutes, because what I'm about to share with you is not the kind of conversation most men ever hear openly, honestly, or without embarrassment. And yet it may affect your energy, your confidence, your sleep, your prostate, your erections, and even how fast your body seems to age after 60. My name is Senior Nutrition Expert, and over the years I've worked closely with older men who all believed some version of the same thing, that changes in sexual function after 60 are just something you accept, stay quiet about, and learn to live with. But the truth is much more important than that. What many men call normal aging is often a collection of habits, misunderstandings, and avoidable mistakes that quietly chip away at blood flow, nerve response, hormone balance, pelvic strength, and emotional well-being. And that is exactly what today's conversation is about. In this video, I'm going to walk you through 7 masturbation mistakes older men make after 60 that can silently work against their health rather than support it. We're counting down from number 7 to number 1, and I want you to stay with me all the way through, because the biggest mistake is also the one most men never suspect. In fact, by the time we reach number 1, you may look at this subject in a completely different way. Now, before we begin, I want to ask you something directly. How old are you, and has any doctor ever spoken to you honestly about sexual health as part of healthy aging? Most men tell me the answer is no, and that silence is part of the problem, because sexual health after 60 is not just about desire. It is circulation, it is prostate function, it is muscular control, it is hormonal signaling, and yes, it is quality of life. Let's begin. Mistake number 7. Using far too much pressure. This is what many people casually call the death grip. It's not a formal diagnosis, but the problem behind it is very real. A lot of men developed this habit when they were younger, when arousal came faster, tissue recovered faster, and sensitivity was stronger. The trouble is, many men keep using the same level of pressure long after the body has changed. After 60, penile tissue is often less elastic, nerve sensitivity may be lower, blood flow is not always what it was at 30 or 40, so when a man uses excessive force, he can gradually train his body to respond only to unusually intense stimulation. That means real-life stimulation may start to feel weaker by comparison. Erections can become harder to maintain. Orgasm may take longer. In some cases, the man assumes his body is failing, when in reality his nervous system has simply adapted to an unnatural level of pressure. There's another problem too. Repetitive friction with too much force can irritate tissue, especially when the skin is drier or more fragile with age. And when that irritation becomes a pattern, it may contribute to soreness, inflammation, or fear around intimacy. The fix is not complicated, but it does require intention. Use a lighter grip, slow down, let arousal build instead of trying to force it. If the body needs more gentleness now than it did 20 years ago, that is not weakness, that is wisdom. You work with the body you have today, not the one you had at 35. Mistake number 6, skipping lubrication. I cannot tell you how many older men never even consider this. They think lubrication is unnecessary, or somehow only meant for younger people, couples, or special situations. That is simply not true. As men age, the skin changes, hydration changes. Hormonal shifts can affect tissue quality, and when friction increases while natural comfort decreases, the result is often tiny irritation that a man may barely notice in the moment, but absolutely feels over time. Sometimes that shows up as tenderness, sometimes as reduced pleasure, sometimes as a sense that things just don't feel the same anymore. Many men try to solve this by adding more pressure or speed, which only makes the cycle worse. They mistake discomfort for lack of stimulation and respond by becoming rougher. That is exactly backward. A good lubricant can reduce friction, protect the skin, make sensation more natural, and encourage a gentler technique automatically. In other words, lubrication is not about dependency. It is about reducing unnecessary stress on tissue that deserves better care than it often gets. If dryness, discomfort, or irritation have become common for you, don't ignore it. Your body may be telling you that what once felt normal is no longer the healthiest approach. Sometimes the smallest change creates the biggest improvement. Mistake number 5, doing it while mentally overloaded and chronically stressed. This one surprises many men, because they assume masturbation is always relaxing no matter what state they're in. But your body does not separate sexual response from stress the way your mind tries to. If your nervous system is flooded with tension, worry, frustration, poor sleep, or emotional strain, your arousal response changes. Stress affects breathing. It affects focus. It affects blood flow. It affects hormone signaling. A man may still go through the motion, but the body is often not fully cooperating. Erections may be weaker, sensation may feel dull. The experience may be rushed and unsatisfying, and instead of feeling restored afterward, he feels flat, irritated, or strangely disconnected. That matters more after 60 because recovery is not always as forgiving. The body thrives on the right internal environment. When arousal happens in the middle of chronic stress, it often becomes mechanical instead of restorative. So here is the practical correction. Before sexual activity, pause. Not for an hour, not for some elaborate ritual. Even 5 to 10 minutes can make a difference. Sit down, breathe deeply, put the phone away. Let your shoulders drop. If possible, take a short walk first. Create a transition so your body knows it is safe to shift from tension into pleasure. That may sound simple, but the men who do this often notice something powerful. Stronger response, calmer focus, and a much more satisfying finish. The body performs better when it doesn't feel ambushed. Mistake number 4, rushing the process. This is one of the most common patterns I see in older men, especially those who treat masturbation like something they need to get over with quickly. There is no warm-up, no gradual buildup, no attention to breathing, no awareness of the body, just speed. But after 60, the body often responds better to progressive arousal, not abrupt stimulation. Blood vessels need time to dilate. Nerves need time to wake up. The pelvic floor needs coordination. The mind needs engagement. When you rush past that, you may get a weaker erection, a shorter peak of pleasure, and a much less satisfying release. Think about it this way. You would not expect stiff muscles to perform well with no warm-up. You would not expect your heart to love sudden strain if you've been sitting for hours. Yet many men expect their sexual response to arrive instantly on command, even when the rest of the body has not been prepared. Slow is not a downgrade. Slow is often what allows the body to function better. More blood flow, more sensation, better control, better orgasm, less frustration. And let me pause here for just a moment. If this conversation is already opening your eyes, take a second to support the channel. Like the video, subscribe, and stay with me. These are the conversations many men needed 10 years ago, and far too few people are willing to have them honestly. Now let's keep going, because the next 3 are where this becomes deeply important. Mistake number 3, neglecting pelvic floor health completely. Most men over 60 have heard of the pelvic floor, but they assume it is something that matters only for women, only after surgery, or only if there is a urinary problem. That is a serious misunderstanding. The pelvic floor plays a major role in male sexual function. These muscles help support erectile rigidity by assisting blood retention. They influence orgasmic contractions. They affect ejaculatory control, and they help with bladder control as well. When those muscles weaken, men may notice softer erections, less forceful orgasm, reduced control, or that vague but frustrating feeling that everything is just less intense than it used to be. A lot of men believe that fading intensity is simply age. Sometimes age is part of it, but disuse is often part of it too. Let me put it plainly. If you never train a muscle group, you should not be surprised when it stops performing well. That is true for your legs, your grip, your core, and yes, your pelvic floor. The correction here is simple. Learn proper pelvic floor engagement. Not random squeezing all day long, but deliberate controlled contractions with full relaxation between them. A few rounds daily can make a real difference over time. Some men begin noticing better control. Some report improved erectile firmness. Others say orgasm feels more complete and less muted. This is one of those areas where consistency matters far more than intensity. Small practice, repeated regularly, that is how older bodies improve. Mistake number 2, relying too heavily on high-intensity visual stimulation. Now let me be careful here. This is not about shame, and it is not about pretending modern habits do not exist. It is about how the brain adapts. Many men after 60 are dealing with changes in novelty response, attention, and arousal threshold. If the brain becomes used to constant high-intensity visual stimulation, endless novelty, and instant escalation, real-life arousal can start to feel comparatively weak. Imagination may feel dull, physical touch alone may feel less engaging. Patience drops. The brain begins to expect more stimulation than the body naturally provides. For some men, this becomes a hidden reason why solo activity works one way. For some men, this becomes a hidden reason why solo activity works one way and why solo activity works one way. While they don't realize that the problem may not only be physical. They don't realize that the problem may not only be physical. The human brain is conditioning. That is good news and bad news. If you train it to need constant novelty, if you train it to need constant novelty, but if you gradually reintroduce slower arousal, but if you gradually reintroduce slower arousal, imagination, touch-based and less overstimulation, imagination, it can begin adapting back. And that matters enormously after 60. And that matters because the goal is not just climax. Because the goal is preserving natural responsiveness. The goal is preserving connection between mind and body. Preserving the ability to feel pleasure without needing more and more artificial intensity to get more and more artificial intensity to get there. If you suspect this is part of your pattern, reduce the dependency. Don't panic. Create more variety. Reduce the dependency. Let your nervous system rediscover subtler forms of arousal. Let your nervous system rediscover subtler forms of arousal. Sensitivity they regain when they stop by how much sensitivity they regain when they stop overwhelming their own reward system. And now we come to mistake number one. This is the one that surprises people most. This is the one many older men get completely backward. The one many older men get quietly affect prostate health. The one that may quietly affect prostate health and overall well-being more than they realize. And overall well-being more than they realize. Going too long without release. Mistake number one. Because you assume it no longer matters after 60. Because you assume it no longer matters after 60. This is where I need you to listen very carefully. This is where I need you to listen very carefully. A lot of older men gradually drift into long periods of inactivity. Sometimes it is because of shame. Sometimes because of widowhood, shame, divorce. Sometimes because of widowhood, medication, divorce, stress, low libido, depression, medication, or simply the feeling that this part of life is supposed to fade away quietly. They tell themselves it's not important anymore. They tell their body has outgrown the need anymore. That it is better left alone. Their body has outgrown the need. But in many cases, that is not helping them. It is hurting them. But in many cases, that is not helping them. The prostate is not a decorative organ. It is active tissue. The prostate is not a decorative organ. The sexual system is not disconnected from the rest of the body. The sexual system is not disconnected from the rest of the body. Tension release. It is part of circulation, sleep regulation, hormonal comfort, sleep regulation, identity. When a man goes long stretches with no sexual release at all, when a man goes long stretches with no sexual release at all, less responsiveness, he may notice more pelvic tension, frustration, less responsiveness, more and a general decline in that feeling of aliveness, and a general decline in that feeling of aliveness. Now, I want to be responsible and clear. Now, I want to be responsible and clear. Compulsive behavior is not always better. Everybody is behavior is not healthy. Frequency should match comfort. Everybody is different. Health status and medical context. Frequency should match comfort, but many older men have swung too far in the opposite direction. But many older men have swung too far in the opposite direction. With discipline, when in reality, they may just be neglecting a natural system. They may just be neglecting a regular healthy function. That still benefits from regular research has even suggested that more frequent ejaculation is associated with lower prostate cancer risk in some men. That does not mean it is a magic shield. But it does tell us something important. Sexual function in later life is not irrelevant. Sexual function in later life biologically is not irrelevant. And beyond the prostate, still matters biologically. Regular healthy sexual release beyond the prostate may help some men feel calmer, sexual release, sleep better, may help some men maintain a stronger sense of vitality, sleep better, not because it makes a stronger sense of vitality, but because it reminds the body that it is still engaged in life. But because it reminds the body that it is still engaged in life. Men who believe that this chapter was over begin making a few thoughtful changes. They become making a few thoughtful changes. They slow down. They reduce stress. They slow down. Pelvic health. They reduce stress. They stop overstimulating the brain. They support pelvic health. They return to a regular rhythm that actually fits their age and body. They return to a regular rhythm that actually fits their age and body. And over time, they report something better confidence, better sensitivity, better confidence. Sometimes even a renewed sense of dignity. Sometimes even a renewed sense of dignity. Gentlemen, let me bring this home. That matters. Your sexual health after 60 is not a side issue. Your sexual health is not a guilty little corner of life that has nothing to do with the rest of your body. It is woven into the bigger picture of how you age. It is woven into the bigger picture of how you age. Your muscular function, your blood flow, your nervous system, your muscular function, your relationships with pleasure and privacy and vitality. Your relationships with pleasure and privacy and vitality. And the habits you repeat in silence do not stay in silence. And the habits you repeat in silence do not stay in silence. If you use too much pressure, the body adapts. If you ignore lubrication, the body tissue pays the price. If you ignore lubrication, tissue pays the price. If you stay stressed, response arousal suffers. If you neglect the pelvic floor, response performance fades. If you neglect the pelvic floor, too heavily on overstimulation, sensitivity changes. Heavily on overstimulation, and if you go too long, assuming none of this matters anymore, and if you go too long, assuming none of this matters anymore, your body still very much knows how to receive. You may be giving up benefits. Your body still very much knows how to receive today. Here is the message I want you to leave with today. It is not too late to adjust your habits. It is not too late to understand your body better. It is not too late to understand your body better. Your circulation,
it is not too late to
your
support your
confidence,
prostate,
and your quality
your
of life.
circulation,
And it is
your
not too late to
confidence,
stop
and your
thinking of
quality of
aging
life.
as automatic
And it is
decline.
not too late to
and
stop
start thinking of it as
aging as
something you can
automatic
still
decline.
influence. And start thinking
That is
of it
why
as
I
something
make
you
these
can still
conversations.
influence. Because older
That
men
is why I
deserve
make
honesty.
these conversations.
They deserve dignity.
Because
they
older
deserve
men
useful
deserve
information
honesty.
without
They deserve
mockery,
dignity.
without
They deserve
shame,
useful
and without
information
silence.
without mockery.
If this
without
helps
shame,
you, and subscribe to the channel and turn on
If this helped
notifications
you,
so you don't miss what
subscribe
we
to the
cover
channel
next.
and turn on
And I want to hear from you
notifications
in the
so you don't
comments
miss what we cover next.
Which of these 7 mistakes surprised you the most? And has
Which of
anyone
these
in the
7
medical
mistakes
world ever
surprised you
talked
the
to you
most?
openly about
And
this
has
part of your
anyone in
health?
the medical world
Take
ever
care of
talked to you
yourselves,
openly
gentlemen.
about this part of
You've
your
earned
health?
that care.
Take care
This
of
is
yourselves,
Senior Nutrition
gentlemen.
Expert.
You've earned
and I'll
that
see you
care.
in the next